Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. AI breakthrough. Predicting premature deaths in inflammatory bowel disease patients. Almost half of people who died with inflammatory bowel disease died prematurely, according to a study published in CMAJ, Canadian Medical Association Journal. People with IBD have shorter life expectancy than people without such diseases, and they can develop other chronic health conditions related to their IBD. The study found that people with IBD are at risk for premature death, defined as deaths before age 75, when they develop other chronic health conditions earlier in life. The clinical implication is that chronic conditions developed early in life may be more important in determining a patient's health trajectory, although further causal research is needed to elucidate this relationship, writes Dr. Eric Benchimol, a pediatric gastroenterologist and senior scientist at the Hospital for Sick Children, professor of pediatrics and epidemiology at the Premature Faculty of Medicine, University of Toronto, and a senior co-scientist at ICES. Urine test could drastically reduce post-surgery scans for kidney cancer patients. A simple urine test could accurately show the recurrence of kidney cancer at an early stage, potentially sparing patients invasive scans and enabling faster access to treatment, new research has shown. The findings are presented at the European Association of Urology Congress in Madrid. The test analyzes the distinctive profile of certain types of sugar molecules called glycosaminoglycans, which are found in urine. These profiles are known as GAG-OM. Currently, the only way to monitor patient is through a scan, usually a CT scan, every 6 to 12 months, with the frequency depending on their level of risk. The study's initial cohort involved 134 patients treated at 23 hospitals across UK, EU, USA and Canada. The patients were all diagnosed with ccRCC, which had not spread beyond the kidney and which was treated with surgery. Most had their kidney completely removed. All patients continued to have CT scans as standard monitoring after surgery, alongside a urine test every 3 months. Each urine sample was analyzed using mass spectrometry to produce a score out of 100 called GAG-OM score. High-resolution ultrasound promises quicker prostate cancer diagnosis. Biopsy guided by high-resolution ultrasound are as effective those using MRI in diagnosing prostate cancer, an international clinical trial has shown. The technology called micro-ultrasound is cheaper and easier to use than MRI. It could significantly speed up diagnosis, reduce the need for multiple hospital visits, and free up MRI for other uses, researchers say. The results of the Optimum trial are presented at the European Association of Urology Congress in Madrid and published in JAMA. Optimum is the first randomized trial to complete micro-ultrasound guided biopsy with MRI guided biopsy for prostate cancer. It involves 677 men who underwent biopsy at 19 hospitals across Canada, the USA and Europe. Of these, half underwent MRI-guided biopsy, a third received macro-US guided biopsy followed by MRI-guided biopsy, and remainder received macro-US guided biopsy alone. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.